Hi, I'm Dr. Sehgal. I'm a board-certified orthopedic sports surgeon. I get a lot of questions about PRP. PRP is called platelet-rich plasma. It's basically a concentration of your body's natural healing potential. So when you get a cut on your skin, basically your body signals platelets to go to the site of the injury and repair the cut. And it uses growth factors to do that. And what we do is we concentrate those platelets in your body, in your blood, and we spin it down and we inject that into the site of injury. Whether it's a shoulder, a knee, tennis elbow, golfer's elbow, arthritis, it can really help improve and help solve a lot of these injuries, and sometimes without surgery. I believe in PRP so much that I actually had it done in my own shoulder. I had a rotator cuff injury about a year ago with calcium in my shoulder, and I couldn't sleep at night. I couldn't play baseball with my son, and it was just causing a lot of issues. So I got a cortisone shot, and it helped for about 3 to 6 months. I pretty much had no issues, but then it started coming back again. I couldn't sleep at night again, and just any movements were causing me pain.
The first step in doing PRP is a blood draw. Just a little pinch, but here's a secret. Hydrate, 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 and it'll make things a lot easier. First, we're gonna clean the skin and prep it to make sure it's sterile. And then just a little butterfly needle here. Little pinch.
All right, that wasn't too bad. I barely felt that.
We extract 1 vial of blood from the patient depending on how much we need. And then we take that blood to the centrifuge. And as you can see, the plasma-rich platelets is the yellow-colored liquid that we often call liquid gold. So the third step in the PRP process is ultrasound guidance. We use the ultrasound to help guide placement of the needle so that we can be more accurate to where the PRP goes. First, we're gonna go do a diagnostic, assess for the bicep tendon here and the bicipital groove. Then we're gonna ask the patient to please externally rotate your arm. Externally rotate your arm, checking for the subscapularis muscle. Subscapularis looks good. That's not where his pathology is. The third process is go ahead and put your hand behind your back. And that helps bring the supraspinatus tendon into view, taking it out from under the acromion. And you can see where he has calcifications of the tendon over here. But again, you can see it intact. As we move back, we can see better where the rest of the supraspinatus tendon is. And from here, we get a good location of where we can do the injection. So we've already prepped the skin, cleaned it, sterilized it. Then we're gonna go ahead and cold spray.
This numbs it up really nicely.
After the cold spray, we take the injection. We go ahead and introduce the needle.
Oh wow, I can see it. It's so cool.
And then we go ahead and aspirate first, and then we inject.
We're trying to get over my calcium. I have calcium in my tendon. I have a partial tear, so we're trying to go in that area. And I feel it really, yeah. And I can kind of see it on there, what it looks like. Wow, didn't bother much at all. Felt really good.
And all we do from here is clean them up, bandage them up, and the healing process is ready to begin.
So I had the PRP and it worked great. The first day was a little sore. By the third day, I had more motion than I ever had in the past year. And then by around 4 to 6 weeks, I was sleeping throughout the night, no pain, was not waking me up, and I'm able to play baseball with my son again, and it's working till this day.